Hi, in this video we'll be looking at the Glasgow Coma scale or score. As an EMT, we are supposed to have this score or scale at our fingertips. So we'll be looking at how to score a patient using the GCS, which we normally call the Glasgow Coma score. And the Glasgow Coma score is used to assess the level of consciousness of a patient who is having an acute brain injury, both medical and trauma. And it comes in three specific findings. One, the best eye opening, two, verbal response, and then three, motor response. The highest score for both of the three categories is 15 and the lowest is 3. So when we begin with the eye opening, the highest score on the eye opening is 4. And when you look, so before you begin in assessing the patient under the eye opening, first make sure you check whether the patient is able to open the eye spontaneously without activating with a voice or pain. If the patient is able to open the eye spontaneously, you score the patient 4. If the patient is not able to open the eye spontaneously, then you move on to voice. Then you need to what? Initiate a voice stimuli by talking to the person. If the person is able to open the eye, with your voice, then you score the patient 3. If the patient is unable to open the eyes to your voice, then this is where you inflict pain to the patient. And when you inflict pain and the patient is able to open the eyes, then automatically you score the patient 2. But in all this, the patient is not able to open the eyes spontaneously to your voice and then to the painful stimuli you apply to him or her, then that means the patient is not responsive to anything, so you score the patient 1. Now, with the eye opening, basically we term it as the AVPU, which you normally assess on the level of consciousness of a patient. So the A, the alertness, basically stands for the spontaneous, the V stands for the voice, and then P stands for P, which you score the 2, and then unresponsive basically terms as none, which you score 1. Now, when you move down to verbal response, the highest score you give under verbal response is 5. So now you are saying that before you begin, you make sure you assess the patient. Is the patient oriented times 3? So you are saying that oriented times 3 basically means the patient is oriented to person, place, and time. So if your patient is oriented to place, person, and time, you score the victim 5. Then confused. Now with confused, you are just you grade a confused to the orientation times 3. Meaning if the patient scores is oriented to only either person and person, but not to time, then the patient is confused. So you score the patient 4. Or the patient is only oriented to person and time, but not place, you score the patient 4. Then inappropriate words. So inappropriate words basically means that you can ask or introduce yourself to the patient. My name is Abdulhamid. Please, what's your name? And the patient starts mentioning today's date. It's an inappropriate word. So you score the patient 3. Then incomprehensible sounds. You realize that the patient will be speaking in tones or will be murmuring. Basically, patients, when you look at patients with CVA, they have a slurred speech. So you find it difficult to understand what they are saying. So they produce an incomprehensible sound. Now, if the patient is not able to produce any incomprehensible sound and is silent, then that means you score the patient 1, which we term it as what? None. Then we move to motor response. The motor response basically means the patient movement of the limbs. So you now issue a command to the victim by asking him or her to raise either the lower extremity or an upper extremity. If he or she obeys, then you score the patient 6. Now, if the patient is unable to obey, then now you need to inflict pain on the patient. Now, you need either you inflict pain at either the trapezoid, or you inflict pain to either the patient's sternum or any part of the patient. If the patient is able to localize the pain by either assuming you inflict pain at the trapezoid and the patient is able to localize that place, you score the patient 5. If still you inflict pain at the trapezius, the patient is unable to localize the pain but withdraws from the pain, you score the patient 4. Now, you inflicted the pain on the patient didn't localize the pain, he or she didn't withdraw from the pain, but produce a decorticate fleshing. We call it an abnormal fleshing. Realize that the patient will do this way. Rather, after you've applied a pain on the patient will flex the arm this way and the legs inside, and it looks in the form of C. Now, it basically indicates a problem with the patient's cervical spine, or the patient's cervical spine or the brainstem. Now, the cerebrate extension basically realize that instead of the patient localizing pain or withdrawing from the pain, will extend the arms. So we extend the arm. So this is how you see the patient extending the arm. Whereas the patient will extend the arm this way. So with the decorticate fleshing, the patient will flex the arm this way and the legs inside. But with the decelerate extension, we'll do the arms this way. To your pain, we've applied to him or her. So in that time, it's an indication that there is a problem with the patient's brainstem, or we call the midbrain or pons. You score the patient 2. Now, if the patient is unable to respond to your pain, the pain you inflict on him or her, and that means you score the patient 1, which is under 9, none. Now, we are saying that the highest score for under the GCS is 15, and the lowest is 3. So, like it's generally said, even a stick will score 3. Now, let's look at how to categorize the scores. Now, from 3 to 8 indicates a severe brain injury. So any score 8 and below indicates a severe brain injury. From 9 to 12 indicates a mild brain injury. And then from 13 to 15 from 9 to 12 indicates a moderate brain injury. And then from 13 to 15 indicates a mild brain injury. So basically, this is how we score the Glasgow Coma score on the patient who is suffering from acute brain injury. And remember, it's scored on both medical and trauma victim. Thank you very much once again.